You don't forget the moment you realize you're going to lose someone twice. The first time is the hard one. The ending you see coming, the divorce papers, the moving trucks, the lawyer calling to tell you the number's been changed and your ex-wife has relocated to another state. That's the loss you know how to grieve. It's clean, in a way. Final. You know exactly what you've lost because you can name it. The second time is different. The second time, you don't see it coming. The second time, you lose someone you didn't know you still had. My name is Jess, and I'm telling you about Dr. Vincent Harlow because what happened to him in an operating room on a Saturday night in March isn't just a medical story. It's a story about the invisible ways we're all still tethered to the people we love, even when we think we've severed the rope completely. It's about how the past doesn't stay buried, how it surfaces when you least expect it, demanding to be reckoned with. I've learned in my years as a trauma nurse that the body keeps score. It holds on to the things the mind tries to forget. Dr. Harlow had been a trauma surgeon at the VA hospital in Denver for 17 years. Before that, he was a surgeon in the Army, stationed in Kandahar, Afghanistan. 20 years in medicine, total. 20 years of opening people up, of finding the bleeding, of stopping it, of stitching them back together. 20 years of the kind of precision and certainty that only comes from doing something 10,000 times. His hands were legendary. Even the younger surgeons, the ones just out of their residencies, still trembling slightly on their first solo surgeries. They wanted to watch Dr. Harlow work. They wanted to know how someone maintained that kind of calm under pressure. How someone could stand there at 2 a.m, a patient's abdomen open in front of them. Blood, chaos, machines beeping, and still think clearly enough to make the right call. I've seen him do it. I've watched him work, and I've never seen anyone maintain that level of composure while his hands are literally inside another person's body. I've worked with hundreds of surgeons in my nursing career. I was a trauma nurse at that same VA hospital for 12 years before I moved into education. Former military myself. Navy Corps, 8 years. You learn something in the military that you can't learn anywhere else. You learn that compartmentalization isn't a character flaw. It's a survival mechanism. You learn to separate what needs to get done from how you feel about it. You lock up your emotions and you move forward. That's how you function in impossible situations. That's how you save lives when the alternative is falling apart. And I can tell you that Dr. Harlow was different from the other surgeons. Not because he was necessarily a better surgeon than anyone else. Though he was certainly skilled enough. I've assisted on hundreds of surgeries, and I can tell you the difference between good and exceptional. Harlow was exceptional. But what made him different? What made him stand out in a way that shouldn't be possible was something nobody ever puts in medical journals. It was a ritual, a superstition almost, though he would never call it that. He had a personal rule that he'd followed since his military days, since his commanding officer in Afghanistan, Colonel Daniels, had told him something that stuck so deeply you could see it moving him every time he spoke about it. You cut better when you know who you're saving. Colonel Daniels meant something by that beyond the literal. It wasn't just about knowing a name. It was about seeing the patient as a person before you open them up. Before the surgical drapes reduce them to a sterile field, a surgical site, a problem to be solved. Before the anesthesia and the machines and the monitors turn them into vitals on a screen. Vincent Harlow had taken that lesson and built his entire career around it. Before every single surgery, no matter what the circumstances, no matter how emergent the case, no matter how many other surgeons were already in the ORs waiting, he would find the patient. He would read their chart. He would learn their name. He would know them. Sometimes he'd even speak to them before surgery. A quick word, a hand on their shoulder, a promise. He'd walk into the OR with that knowledge in his chest, and his hands would move with that knowledge guiding them. I watched him do this, and it worked. It genuinely worked. His outcomes were better than anyone else's. His complication rates were lower. His patients lived when they shouldn't have. But there was a cost to that ritual. There always is. You can't see your patients as people without taking some of that with you when you leave the OR. And over 17 years at the VA hospital, Vincent Harlow had accumulated a lot of ghosts. I could see them sometimes. In the way he'd stand outside the recovery room after a difficult case, just breathing. Just letting himself feel it for a moment before he had to move on to the next case, the next patient, the next impossible decision. That's compartmentalization in practice. You feel it. You acknowledge it. Then you lock it back down because there's work to do. What I didn't know, what nobody knew, was that Vincent Harlow had a different kind of ghost. A living one. A ghost that was supposed to be gone from his life completely. It was March. A Saturday. Saturday nights at a trauma hospital are always chaos. MVAs on the highway, falls, assaults, the kinds of injuries that come from weekend drinking and poor judgment. The ED had been flooded all day, and the surgical schedule was backed up. Dr. Harlow had finished a 7-hour exploratory surgery on a gunshot victim who'd made it out of surgery, but just barely. A wound to the left upper abdomen that came close to perforation, but didn't quite get there. He was heading to the locker room to change when the overhead alert came through. Incoming trauma, multi-vehicle accident on I-25. Multiple patients. The ambulance was 10 minutes out. He changed out of his scrubs and back into clean ones. This was routine. He stood in the pre-op area with his hands already starting their preparation, mentally running through the protocol. Multi-vehicle accidents meant multiple traumas, meant multiple possible outcomes. If the patient was critical enough to call him in on a Saturday night, the other surgeons were likely already in the ORs. He was probably going to get the worst of the bunch. The ambulance arrived with sirens and urgency. The paramedics wheeled in a patient on a gurney. Male, appeared to be in his 30s. Unconscious, significant trauma to the left side of his body. Obvious fracturing, massive abdominal contusion. The patient was intubated already, breathing on a ventilator tube. No consciousness, no response. The paramedics rattled off vital signs in that rapid-fire way they have. The numbers that tell the story of a body in crisis. BP 82/48, heart rate 130, OSAT 91 on high flow. They ran through what they'd found at the scene, what they'd done in transit, the trajectory of the patient's condition. Down the whole way in. The ED team moved into high gear, placing lines, running labs, getting imaging. I've seen this dance 1,000 times. The organized chaos of an emergency department receiving a critical patient. Everyone knowing their role, everyone moving with purpose. And then came the complication that wasn't actually a complication. It was just reality in an emergency department. The patient had no ID, no wallet, no identifying information on his person. The paramedics had found him unconscious in the vehicle wreckage, ejected from the driver's side. No phone, no medical alert bracelet. He was a John Doe, and he was hemorrhaging internally, and time was running out. This is something you don't talk about much in trauma medicine, but it matters. When you don't know who someone is, you lose something crucial. You lose their history. You lose context. You lose the story that explains why they matter. The ED physician, Dr. Prescott, the chief of surgery, came to Dr. Harlow while the nurses were still prepping the patient for transport to the OR. Prescott is a good man, meticulous, by the book. He's been at the VA hospital almost as long as Harlow, and I respect him. But he's not a risk taker. He's a believer in protocol, in rules, in the systems we've built to protect us from our own emotions. "We don't have a name yet," Prescott said. His voice was level, clinical. "Fingerprints are being run through the VA system, but it's going to take a few minutes. Patient's too unstable to wait long. We might need to move him upstairs before we get an ID." Dr. Harlow nodded. He understood the protocol. In cases where the patient is in extremis, you don't wait. You don't know their name, you don't know their history, you don't know if they're allergic to penicillin or if they have a bleeding disorder or any of the 1,000 things that could matter. You just go in and you fix what's fixable. You save what you can save. That's trauma medicine. That's the job. But Vincent Harlow had made a commitment to himself years ago in the mountains of Afghanistan, when Colonel Daniels had told him that you cut better when you know who you're saving. And he stood there, looking at the unconscious man on the gurney, at the machines keeping him alive, at the clock on the wall telling him that every second mattered, and he made a decision. I've thought a lot about this moment since. I've tried to figure out what was going through his head. Was it discipline? Was it ritual? Was it something that went beyond either of those things? "We wait," he said. 2 minutes. Give me 2 minutes. Prescott looked at him. The two men had worked together for 15 years. Prescott knew about the ritual. He'd seen Dr. Harlow refuse to go into cases until he knew the patient's name. He'd seen it work. He'd also seen it cost time in situations where time was life, where those extra minutes meant the difference between a patient who made it and a patient who didn't. But Prescott also knew that in 15 years, Vincent Harlow's outcomes were better than anyone else's in the department. The numbers don't lie. Maybe there was something to it. Maybe the ritual wasn't just superstition. 2 minutes, Prescott confirmed. His voice was steady, authoritative. "Then we go, name or no name." The ED staff kept working. Lines went in. A central line was placed. Blood was hung. Type O negative, universal donor, because they didn't know what this man's type was. Imaging came back. Catastrophic internal bleeding, likely from a hepatic laceration. Multiple rib fractures. Pneumothorax on the left side. The patient was dying. The monitors showed it. The labs showed it. The clinical picture was undeniable. The patient was dying, and they were all stalling, standing in the ED bay, while a man bled out, waiting for a fingerprint match that might never come. That's the thing about medicine that they don't teach you in school. You learn the protocol. You learn the anatomy. You learn the pharmacology. But nobody teaches you how to stand still while someone's life is measured in minutes. Nobody teaches you that comfort with waiting. 90 seconds passed. The monitors kept beeping. The IV pumps kept running. Time moved differently in that moment. Jess has learned over the years that time works like that in medical situations. Minutes stretch, seconds expand. The clock keeps moving, but the internal experience of time becomes something else entirely. Then one of the administrative nurses came running through the doors with a printed record. Her face was pale. I remember her name. Lisa. She'd been working in administration for 8 years, and I'd never seen her move that fast. "We have a match," she said. Her voice was shaking. System came back positive. Patient is listed in the VA database. Dr. Harlow stepped forward. His hand was already reaching for the paperwork. I could see it in his movement. There was something driving that reached beyond simple professional interest. Lisa handed it to him. She watched his face as he read the name. She later told me, because I interviewed her for this story and she was eager to talk about it, that she watched his entire face change in a way she'd never witnessed before. not just change, freeze. Like someone had pressed pause on his entire system, the way a person freezes when they receive information that rewrites their understanding of the moment they're living in. The way you freeze when you learn that the car accident happened on the street where your best friend lives. The way you freeze when someone tells you news that collapses time. The patient's name was P.F.C. Daniel Harlow. Vincent Harlow read that name, and for the first time in 20 years of surgery, his hands started to shake. The silence in that ED bay was complete. You can have a room full of machines and monitors and alarms and voices and still have silence. This was that kind of silence. The silence of everybody realizing that something had shifted in the room. The silence of a moment becoming something else. I wasn't there, but Lisa told me. She said the whole room understood immediately. You don't have to be brilliant to understand the gravity of that moment. A man with Vincent Harlow's composure. A man who'd stood in operating rooms with limbs hanging by threads of muscle and blood spraying across surgical fields, standing frozen while reading a piece of paper. It meant something. "Run it again," Vincent said. His voice was different. Nobody had heard him sound like that before. It was stripped of all the authority he normally carried. It sounded like a man asking for mercy. "Sir, we're losing the patient," one of the nurses said gently. Professional, kind, recognizing that something had happened to the doctor, but also knowing that a patient's life was measured in minutes. "Vitals are dropping. We need to move to the OR." "Run it again," he repeated. But there was no conviction in it. He was already moving toward the decision he had to make. Prescott was looking at the printout as the name Harlow. He was looking at Vincent Harlow, now standing frozen, the paperwork in his hands. Looking at that piece of paper like it was the only real thing in the world. Understanding flickered across Prescott's face. He's a smart man. Brilliant, actually. It didn't take him more than a second to understand what that moment meant. "Vincent," he said quietly. His voice was different now. It carried respect instead of just authority. "Let's move upstairs. We can verify the ID once we have him stabilized." "The name is Harlow," Vincent said. He looked at Prescott. I wish I could have seen his face in that moment. "The patient's last name is Harlow." "I see that," Prescott said. "My name is Harlow. That's my—" He stopped. He didn't finish the sentence. He couldn't finish it, because finishing it would mean speaking something out loud that he'd spent 14 years not speaking. And I understand that. I understand the weight of words that have never been spoken aloud. Once you say something, you can't take it back. Once you claim someone as yours, you're responsible for that claim. The room understood. The room got very quiet in a different way. Lisa told me that the younger nurses looked confused. They didn't have the context. They didn't know what the name Harlow meant beyond its appearance in a database. But the older staff members knew. You could see it in their faces. The understanding that something personal had collided with something professional, and the collision was creating shrapnel. "We need to move," one of the nurses said. Her voice was steady, but urgent. "Dr. Harlow, we need to move now. His pressure's dropping." And Vincent Harlow, trauma surgeon, looked at the unconscious man on the gurney. The man with his last name. The man whose identity had just materialized from a fingerprint database. The man who was supposed to be gone from his life. Who was supposed to be an ex-wife's problem and an old ache and a closed chapter of his personal history. And he said the words that changed everything. "I'm operating. Get him upstairs. Now, I need you to understand what that decision meant. According to hospital protocol, if a surgeon has a personal connection to a patient, they're supposed to recuse themselves. It's not just a rule. It's an ethical standard. It exists for a reason. Personal connection clouds judgment. Personal connection makes you take risks you wouldn't normally take. Personal connection makes you unable to make the rational calls that surgery requires. The protocol exists because surgery is about being objective, being separate, being the cold hand that fixes what's broken without the interference of emotion. But Vincent Harlow knew something that the protocol didn't account for. He knew his own hands. He knew what they could do. He knew what they'd done in operating rooms across 2 continents. He knew his level of skill, his instincts, his ability to stay calm under pressure. And he knew, standing in that ED bay, that no one else in the hospital had a better chance of saving that patient. Vincent Harlow violated that protocol. He walked into that operating room knowing that the unconscious man on the surgical table, the man they were about to open up, the man whose survival was now entirely in his hands, was his son. A son he hadn't seen in 14 years. A son he didn't even know was alive and conscious in the world until 30 seconds before they wheeled him into surgery. The team prepared for surgery. The anesthesiologist, Dr. Patricia Gomez, who had worked with Vincent for a decade and knew his rhythms, his preferences, his needs. Got the patient intubated deeper, got him sedated, got him stable enough to last the next 8 to 10 hours. She was professional, clinical, but her hands were careful. She took extra time. Gomez is like that. She gives each patient the dignity of her full attention. The nurses prep the abdomen, running the surgical scrub across the skin in those practiced circles, painting it with betadine, creating the sterile field. That's the moment when a patient becomes a canvas, when they transition from a person to a surgical site. Instruments were laid out on sterile trays. Scalpels, clamps, retractors, all the tools of surgical intervention arranged with precision. The overhead lights came on, those brutal, white surgical lights that turn everything below them into a landscape of clinical necessity. They're cold lights, unforgiving. They show you every imperfection. Vincent Harlow stood on one side of the table. Mia Torres stood across from him, the OR nurse. She'd worked with him for years. She knew the rhythm of his surgery, the way he moved, the instruments he needed before he asked for them. His hands went through the ritual preparation, the surgical gloves, the sterile gown, the mask that covered his nose and mouth. The loops came down over his eyes, magnifying glasses that would let him see into the body with precision. He was becoming what he always became in the OR, a precision instrument, a mechanism of focused will and trained muscle memory. A surgeon operating at the limits of human capability. But underneath, his heart was doing something it hadn't done in 14 years. It was hoping. It was hoping that he could fix this, that he could reach inside the body of a stranger who shared his name and undo what the accident had done. The opening cut was a long vertical line down the midline of the abdomen, made with absolute precision. The blade separated skin, then fat, then the peritoneal membrane. That's the moment when you're truly inside someone. That's the moment when you pass the boundary between outside and inside, between what you can see on the surface and what's actually happening in the depths. Inside the abdomen, there was chaos. Blood, free fluid. The liver had a massive laceration across its superior lobe, likely from the steering wheel impact. The spleen was shredded. There was bleeding from multiple sources, and the body's attempt to compensate was failing. The pressure in the abdomen was building. The patient was filling up with his own blood. If Vincent didn't control this quickly, the cascade would accelerate. Bleeding leads to shock. Shock leads to coagulopathy. Coagulopathy leads to uncontrollable hemorrhage. It's the death spiral in trauma medicine. This was the kind of case where you have maybe 3 chances to get it right. You identify the bleeding. You control the bleeding. You repair what you can repair and decide what you have to let go. 3 chances, and then the patient either makes it or doesn't. You're operating at the edge of chaos. One wrong move, and everything falls apart. "Clamp," Vincent said. His voice was steady. The nurse, Mia Torres, handed him the clamp without hesitation. She knew what he wanted before he asked. She handed him the instrument with the precision of muscle memory. He opened it, placed it, controlled the hepatic artery bleed first. That was the biggest one. That was the one that would kill the fastest. The blood, which had been spraying freely, suddenly slowed. Pressure came off the field. "Suction," he said. Mia suctioned. She knows how much pressure to use, knows that too much suction damages tissue and too little leaves blood pooling in the field. The blood cleared. He could see now. He could see the actual anatomy beneath the hemorrhage. He could see exactly what he was working with. Behind his surgical loops, Vincent Harlow was in a state that most people will never experience. He was simultaneously performing the most technically demanding work of his career, and simultaneously living his personal worst nightmare, and simultaneously hoping against every rational thought that he could save this man, that he could fix something, that this moment, 14 years too late, meant something. His hands moved with absolute precision, even as his mind was fractured into impossible places. The next 40 minutes of the surgery is what separates surgeons of Vincent Harlow's caliber from everyone else. This is where you see the difference between someone who's been trained to do surgery and someone who was born to do it. He worked with absolute precision, identifying each source of bleeding, controlling it, repairing what could be repaired. The liver laceration was too extensive to repair primary, so he performed a formal hepatic resection, removing the damaged portion of the liver. He had to be careful. The liver regenerates. You can remove part of it, and the body will rebuild what's needed. But you have to be precise about what you take and what you leave. The spleen couldn't be saved, so it came out. He isolated it, controlled the splenic artery and vein, removed the organ that had been shredded beyond repair. But he got the bleeding controlled. He got the patient stabilized. Slowly, over minutes that felt like hours to everyone watching, the monitors stopped screaming. The vital signs improved. The blood pressure came up. The oxygen saturation came up. The patient, who had been in the process of dying, was suddenly in the process of surviving. Mia Torres watched his hands the entire time. She told me later that she noticed the tremor in his fingers, slight, barely noticeable. But it was there, like something was vibrating under the surface of his skin. But it never interfered with his work. His hands moved with the same precision they always did. The tremor was internal. It was about what was happening inside him, not about what he was doing in the patient's abdomen. "Good work," Prescott said from the corner of the OR where he'd been observing. The chief of surgery always observes cases where there are complications, where protocols have been bent. Prescott had stayed to watch, to see whether Vincent Harlow's violation of protocol would result in miracle or disaster, to see whether love could make you a better surgeon instead of a worse one. It was turning into a miracle. The closing took another 2 hours. Careful work, no rushing. Even though the patient was stable now, even though the immediate crisis had passed, Vincent wasn't any less meticulous. He irrigated the abdomen, checked for any remaining bleeding, confirmed clean. Every inch of the surgical site inspected. The peritoneum was closed, the layer protecting the organs above. The fascia was closed, the layer that gives the abdomen structure and strength. The skin was closed with the kind of exact, even suturing that you see on people who've done it 10,000 times. Each stitch placed with care, each knot tied with confidence. The last stitch went in with a knot that would hold forever. That's how Vincent Harlow sews. Like the closure itself is sacred. Like the way you close matters as much as what you did inside. "That's a close," Vincent said. His voice hadn't changed. His hands hadn't stopped shaking the entire surgery, not enough to affect his work, but enough that Mia noticed. She'd been watching him the entire time, anticipating his needs, handing him instruments before he asked for them, being present in that way that only an OR nurse truly understands. She'd seen the tremor in his fingers, seen the way his jaw was clenched, seen the intensity in his eyes behind the loops. She'd seen a man trying to hold himself together while his world was being remade around him. The patient was closed, alive, stabilized. His chances of making it were better now. Not certain. Internal bleeding and organ trauma don't guarantee anything. The body is fragile in ways we don't want to acknowledge. Infection could develop. The healing process could falter. There were 1,000 ways this could still go wrong. But better. Substantially better. As the anesthesia team was preparing to transfer the patient to recovery, one of the nurses, a younger nurse named David, who had been handing off instruments most of the case, said something that made the entire room stop. "Dr. Harlow, is it true you and the patient share a last name?" The room went absolutely still. That's the power of a question that everyone is wondering, but no one has asked. David had spoken the thing that had been sitting in the air since the moment Vincent said, "I'm operating." "Where did you hear that?" Vincent said. His voice was very careful. He was unwrapping his gown, stripping off his gloves, moving through the motions of post-operative cleanup. The rituals that follow surgery, return to normal, shed the sterile field, become human again. "The admin nurse mentioned it," David said. "She said it was unusual. She said you waited for the identification before operating. That's not standard for an unstable patient." The room understood immediately. Everyone in that OR knew that what had happened was extraordinary. You don't make a surgeon wait when time is life. You don't delay surgery on a hemorrhaging patient while a database query processes. Unless something else is going on. Unless something is more important than the protocol. Vincent Harlow didn't answer. He was keeping his face toward the OR equipment and away from the team. Mia Torres was watching him. She was watching the way he moved, the way his shoulders carried tension, the way he kept his expression neutral while his hands gripped the edge of the surgical field like they were the only solid thing in the world. "Is it true?" Mia asked. Her voice was gentler than David's. She knows, in that way, that experienced nurses know things. She probably knew before anyone else said it out loud. She knew because she watches surgeons the way a musician watches a conductor. She reads the small tells, the tension, the emotion breaking through the professional facade. Vincent Harlow stopped. He stood there in the middle of the operating room in his surgical scrubs, the patient behind him on the table. And he made a decision about what he was going to admit. "Yes," he said. He didn't offer more than that. But there was a finality in it. There was an acceptance of something he couldn't hide anymore. Mia Torres looked at the unconscious man on the surgical table. She looked at the IV lines, the monitors, the machines keeping him alive. She looked back at Vincent Harlow. There was something in her expression that I only learned about later, when she told me her version of these events. It was recognition. It was understanding that she'd been witness to something that mattered, that she'd been part of something larger than surgery, that the hands she'd been watching work with such precision had been driven by something beyond technique. "You did good work," she said. "He's going to make it. You saved him." Vincent Harlow walked out of the operating room without responding. He didn't go to the recovery room. He didn't check on the patient's post-operative status. He went to the locker room. He sat on a bench. He put his face in his hands. And for the first time in 14 years, Dr. Vincent Harlow cried. That's what Mia told me. She said she didn't follow him immediately, but after a few minutes, she went to check on him. She found him in the locker room, and he was crying. Not the controlled tears of someone managing emotion. The full, breaking kind of crying that comes when you can't hold it together anymore. The next 48 hours were complicated in ways that have nothing to do with medicine and everything to do with human reality. The patient, PFC Daniel Harlow, began the slow process of waking up from anesthesia. He was in the intensive care unit on a ventilator, sedated to manage pain. But his brain was starting to recognize that he was alive. His eyes were moving beneath closed lids. His body was twitching with the small movements of someone coming back from deep sedation. His body was starting the work of healing. That's what's remarkable about the human body. Even when it's been shattered, even when it's been opened up and reconstructed by someone's hands, it wants to survive. It reaches toward life. And in those 48 hours, people were asking questions. Questions Vincent Harlow didn't know how to answer. How do you explain that you operated on your own son? How do you tell the hospital administration that you violated protocol for personal reasons? How do you stand in front of your colleagues and defend a choice that defies every rule you've taught younger surgeons to follow? Dr. Prescott came to him in his office on Sunday morning. Vincent looked like he hadn't slept. Maybe he hadn't. Prescott came in and closed the door behind him. That was significant. This wasn't a casual conversation. "We need to talk about what happened," he said. It wasn't accusatory, just factual, professional. The hospital is going to want to know why you didn't recuse yourself, why you violated protocol. "Because," Vincent said, "the patient would have been assigned to someone else, someone less experienced, and he wouldn't have made it." "You don't know that," Prescott said. And he was right. You can't know those counterfactuals. You can't know what would have happened if you'd made a different choice. "I do," Vincent said. "I know the other surgeons. I know their hands. I know their instincts. I know what I saw in that abdomen, and I know the level of skill it took to fix it. If I'm being honest, nobody else in this hospital could have done it. Not on a Saturday night, not with the hemorrhage pattern he had, not with the extent of the injury." "That's not the point," Prescott said. And he was right about this too. The point isn't whether you made the right medical decision. The point is whether you followed the rules. The point is the ethical framework that keeps medicine from becoming personal. "My son was dying," Vincent said. His voice was very quiet, so quiet that Prescott had to lean forward to hear him. "My son was dying on a table, and someone wanted me to walk away." The words hung in the air between them. That's when the transformation happened. That's when it became real. Not the surgery, not the medical decision. The moment when Vincent Harlow spoke it out loud. When he claimed his relationship to the patient. When he admitted that his son had been on that operating table. "Your son," Prescott said. It wasn't a question. It was a confirmation that he'd heard correctly, that he understood what Vincent was saying. "Yes," Vincent said. "You're certain?" "Fingerprint match to the VA database. Name is Daniel Harlow. Last time I saw him, he was 17 years old. His mother took him when we divorced, changed their number, moved to Portland. I had no contact for 14 years. Prescott sat down. He was in his 60s, and he suddenly looked very tired. The weight of what Vincent was telling him was settling onto his shoulders. The understanding that what had happened wasn't just a protocol violation. It was a man being reunited with a son he thought he'd lost forever. He enlisted, Vincent continued. He needed to tell this story. He needed someone to know. At some point, he enlisted. He became a military person. He became a soldier. And I didn't know it. I didn't know any of it. He served his country, and I didn't even know he was serving. His mother kept him from me, and I couldn't find him. How did you find out? Prescott asked. Fingerprints, Vincent said. The VA database had his information, military service, medical history, benefits information. It was all there. It's been there the whole time. And I didn't know. My son was already in the system, already registered, and I didn't know. What Vincent didn't know, what he wouldn't find out until later, was what the nurses had found in the recovery room. This is the part that Mia Torres told me about. This is where the story becomes something that transcends the medical decision. This is where you see how the universe works sometimes. PFC Daniel Harlow had been brought in without his phone. The paramedics had found it in the wreckage, however, recovered from the crushed vehicle, and it had been processed into his belongings, cataloged and stored with the rest of his possessions. Later, when Mia Torres was documenting the patient's arrival in the ICU, performing those administrative tasks that happen around trauma, she picked up the phone to verify the patient information against emergency contacts. The phone was locked with a passcode, but the lock screen image was visible. You can see the lock screen without accessing the phone. You can see what someone has chosen to show to the world first. It showed a photograph of a man in surgical scrubs. A newspaper clipping, printed out and used as a wallpaper photo. The clipping showed Dr. Vincent Harlow, identified as a VA trauma surgeon. The headline read, "Veteran heals veterans. Local surgeon dedicates career to military medicine." There he was. Vincent Harlow, frozen in a photograph from a newspaper. A man in scrubs, his hands folded, his expression serious, his eyes carrying the weight of the work he does. Daniel Harlow had been looking for his father, had printed out a photograph of him from a newspaper, had kept that photograph as the first thing he saw every time he unlocked his phone, had been searching 14 years later without knowing that his father was in the same building, in the same hospital system, a different floor, a different specialty, but in the same institution that they both served. That's not coincidence. That's not luck. That's something else. That's the way the universe has of folding people back together. Mia Torres showed that photograph to Vincent Harlow in the ICU, in the recovery room where his son was slowly, carefully waking up. She said nothing. She just showed him the phone. That's all that was needed. She just held out the phone and let Vincent see what his son had been carrying with him. Vincent Harlow looked at the photograph of himself, at the newspaper clipping, at the evidence that his son had been looking for him for some period of time, for how long he didn't know. He looked at the date the clipping was published. It was from 4 years ago. 4 years ago, Daniel Harlow had decided to try to find his father. 4 years of carrying that photograph. 4 years of seeing that image every single time he picked up his phone. 4 years of searching, alone. And Vincent Harlow, who had not cried since the operating room, began crying again. The protocols were complicated. Ethics consultants were brought in. There were meetings about whether Vincent Harlow's decision to operate had been appropriate, whether it should be reported to a larger board, whether it violated fundamental principles of medical ethics. But there were also discussions about outcomes, about the likelihood that any other surgeon would have achieved the same result, about the fact that the patient was alive and stable and improving, when by all rights he should be dead. The numbers matter in medicine. The data matters. And the data said that Vincent Harlow had made the right call, even though he'd made it for the wrong reasons. Or at least, for reasons that the protocol said weren't supposed to matter. The hospital administration, after extensive consultation, decided not to press disciplinary charges. The understanding was that in cases where a surgeon's personal connection results in better outcomes, where the connection motivated rather than compromised performance, where protocols were violated in a way that saved lives rather than endangered them, the ethical equation becomes complicated. Not wrong, just complicated. There's a difference between breaking a rule and doing the right thing. Sometimes they're the same thing. Vincent Harlow was permitted to remain Daniel's primary surgeon through recovery. He was allowed to continue his role as the surgeon who had opened his son up and put him back together. Over the next 2 weeks, as Daniel Harlow slowly woke up, as the sedation was gradually reduced, as his body started talking again, moving his fingers, opening his eyes, eventually recognizing voices, Vincent Harlow sat in the ICU and watched his son come back to consciousness for the first time since the accident. It was like watching someone be born. The gradual return of awareness, the slow recognition that the world existed, the long journey from anesthesia to consciousness. The moment Daniel's eyes opened and stayed open, the moment recognition started to register in his expression, that moment Vincent Harlow felt something in his chest that he couldn't name. It wasn't joy. It wasn't relief. It was something larger than those things. It was the sensation of time folding in on itself, of 14 years collapsing into a single moment. All the years he'd spent not knowing his son, all the years his son had spent searching for him, all of it compressed into the moment when a man watched consciousness return to the face of his child. On the 3rd day of Daniel's consciousness, when the endotracheal tube had been removed and he could speak in a hoarse, painful whisper, Vincent Harlow came into the room. Daniel's eyes tracked toward him, confused. Intubation and anesthesia leave gaps in memory. The mind tries to protect itself by forgetting the bad parts. Daniel didn't know who this man was. He knew machines. He knew pain. He knew the fluorescent lights of the ICU. But he didn't know this man standing at the foot of his bed. "Hello," Vincent said. He was standing at the foot of the bed, keeping distance, giving his son space. "I'm Dr. Harlow. I was your surgeon." "Okay," Daniel whispered. His voice was barely audible, damaged from the intubation tube, raw and painful. Every word cost him. "You were in a serious accident," Vincent continued, speaking slowly, giving his son time to process. "You had extensive internal injuries. You've had surgery. You're recovering well." "Okay," Daniel said again. He didn't seem to have the cognitive capacity for more complex reactions. The anesthesia was still wearing off. His brain was still rebooting from the trauma of surgery and the medication that had kept him asleep. Vincent wanted to say something else. He wanted to say all the things that 14 years of silence had been collecting inside his chest. He wanted to say, "I'm your father." I wanted to say, "I've been looking for you." He wanted to say, "I didn't abandon you, your mother took you, and I didn't know how to find you." He wanted to say, "I'm sorry, I'm sorry, I'm sorry for all the years, for the missing time, for not being there, for not knowing." He wanted to say all the things that had been building in his chest for 14 years. But Daniel was sedated again, drifting back to sleep, the medication pulling him under. And Vincent Harlow stood at the foot of his son's hospital bed and didn't say any of those things. What he did say, to Mia Torres, when she came in to check the monitors, was his phone, the one he had when he was brought in. Do we still have it? Mia nodded. She understood what he was asking. It's in the patient belongings. I can get it for you if you want. Vincent did want. He sat with that phone in his hands, looking at the photograph of himself, looking at the newspaper clipping about his work, his dedication to military medicine, his commitment to healing veterans, looking at the evidence that his son had seen this article, had printed it, had made it his wallpaper, had been looking for the father he didn't know was working in the same hospital. That's what gets me about this story. That's what breaks me open. The certainty that they were looking for each other. The certainty that there was love there, even across 14 years of silence. When Daniel woke up again, fully woke up, with enough cognitive capacity for understanding, he found his father sitting in the chair beside his bed, the phone in his hands. Daniel looked at the phone. He looked at the photograph on the screen. He looked at his father. And Daniel Harlow said, "That's my dad." Vincent Harlow could barely speak. His voice broke into pieces. "Yes," he said, "that's your dad. I've been looking for him," Daniel said. His voice was still hoarse. "My mom wouldn't tell me anything about him. She said he didn't want to be found. But I had this picture, this article. I was going to try to find him." "You found him," Vincent said. His voice was breaking. "You found him, buddy. You found him." The story doesn't wrap up neatly after that. Life rarely does. Daniel Harlow spent another 6 weeks in the hospital recovering from his injuries. Physical therapy began within days of consciousness. Learning to move again, learning to trust his body. Vincent Harlow visited every single day. Not as his surgeon, the medical role had ended, but as his father. They talked. Slowly at first, tentatively, about neutral things, recovery progress, physical therapy, the logistics of discharge planning, the safe topics, the things that didn't require too much vulnerability. Then about bigger things, about what happened in the divorce, about why his mother had cut off contact, about the years Daniel spent not knowing where his father was, wondering if he was alive, if he wanted to know Daniel, if he'd ever think about his son at all, about the loneliness of that uncertainty. And Vincent Harlow answered those questions. He told Daniel that he had tried to find him before technology made it easy to find people, that he had called numbers that were disconnected, that he had hired a private investigator in 2008 who had hit dead ends, that he had spent 14 years thinking about his son, wondering what he looked like, what he did, who he'd become, that he'd saved strangers with the hands that wanted to save his own child. Daniel told him about enlisting, about joining the military because his grandfather, Vincent's father, had been military, and Daniel wanted to understand that part of his family. About serving as a combat medic in Afghanistan, about the work he did, the lives he saved, about getting injured. The scar on his abdomen that Vincent had seen during surgery was from shrapnel. About coming home and finally having the time and resources to try to find his father again. About the decision to drive to Denver, about coming so close. And Vincent told him about becoming a surgeon, about the ritual with Colonel Daniels, about learning every patient's name before surgery because you cut better when you know who you're saving, about 14 years of saving strangers while his own son was out there, unknown and lost and searching for him, about how the ritual had saved his son's life without him knowing it was his son's life he was saving. The accident wasn't a coincidence. It was a highway accident on I-25, and Daniel was coming to Denver for the very first time, to try to find his father, to see if he could locate him at the VA hospital where the article said he worked. He'd done the research. He'd found the hospital. He'd prepared himself for the search. And he was driving toward his father when the accident happened. He'd made it 40 minutes into the city before the accident happened. He was 40 minutes away from his father's hospital when his car hit another vehicle in a rainstorm. 40 minutes. That's nothing. That's a few exits on the highway. That's the distance you could cover in the time it takes to drink a cup of coffee. He was close enough to see the city lights, close enough to be on the same streets as his father. And then the accident happened, and he was thrown backward into the arms of the one person in the world who could save him. 40 minutes. The thought of that, the way fate actually does work, the way threads get tangled and knotted back together in ways we don't predict. That's what Vincent Harlow carried with him. That his son had been looking for him for years. That his son had finally decided to act on that search. That his son had gotten as close as 40 minutes before circumstances tore them apart again. Before an accident put Daniel on the operating table. But the accident also put Daniel in the place where his father would find him. It destroyed his body and brought his father back into his life. And that Vincent Harlow's ritual, his demand to know who he was saving before he opened someone up, had been the thing that brought them back together. The ritual that had always felt important, that had always guided his hands, that had made him a better surgeon, had been waiting all this time to save the person who mattered most. That's the invisible thread. That's how the universe works sometimes. You don't forget the moment you realize that the person you've lost is being handed back to you. That the grief you thought was permanent is actually just dormant. That the time that separates you isn't actually gone. It's just compressed, condensed, waiting to be released. That's the moment where everything changes, where the past stops being past and becomes present again. 2 months later, Daniel was discharged from the hospital. Physical therapy would continue for another 6 months. The injuries would heal, as injuries do. The scars would fade, as scars do. But something had been restored that was never supposed to be restored. Something had been given back. A relationship that had been lost for 14 years suddenly existed again, not unchanged. Changed by the time that had passed. Changed by the things they'd both experienced, but real, present, alive. And every single time Vincent Harlow walks into an operating room, he still asks for the patient's name before he makes that opening cut. He still learns who he's saving. He still carries Colonel Daniel's lesson in his chest. You cut better when you know who you're saving. Because he learned, in an operating room on a Saturday night in March, that knowing who you're saving isn't just about medical outcomes. It's about the unseen threads that connect every person to the people who matter to them. It's about how we're all more than the sum of our injuries. It's about the belief that everyone who comes into your operating room deserves to be known, to be seen, to be treated like they matter because they do matter. To someone, they matter. This is a story about trauma surgery and hospital protocol, and a son's desperate search for his father that lasted 14 years. But mostly, it's a story about the way love insists on being found. No matter how many barriers you put between it and the person it's meant to reach. It's about how you can lose someone so completely that you stop believing you'll ever find them. And then one day, they show up on your operating table, and you have to choose between following the rules and saving the person who matters most. Dr. Vincent Harlow chose to save his son. The hospital eventually forgave him. And maybe that's the story that matters most. Not the medical miracle, though that happened. But the moment where a man realized that the most important surgery of his career wasn't actually a surgery at all. It was recognizing the person you'd lost. It was knowing their name. It was the ritual that saved his life. It was a chance to come home.